You are listening to the PGX for Pharmacists podcast, part of the Pharmacy Podcast Network. Pharmacogenomics is the study of how genes affect a person's response to drugs. This revolutionary science combines pharmacology and genomics to develop effective, safe medications and doses that will be tailored to a person's genetic makeup. There's no better healthcare provider positioned to leverage the analytical power of pharmacogenomics to provide more effective medication therapies and outcomes than a clinical pharmacist. And now, here's the host of the PGX for Pharmacists podcast, pharmacist, researcher, and national pharmacogenetics expert, Ken Sternfled.
Thank you again. And welcome to PGX for Pharmacists. My name is Ken Sternfled, and I am the host of the show. We are very pleased to welcome a very, very distinguished and forward-thinking individual, Dr. Jason Cavolina. Dr. Cavolina is the president of RXVIP Enterprises, which is the group of pharmacists, PharmDs, and students of pharmacy who have been working together over the last 3 or 4 years to try and create a paradigm shift for the way pharmacists can practice their profession. Dr. Cavolina, may I call you Jason?
You may call me Jason. Thank you very much for having me on the show today. I'm very proud to be here.
Well, Jason and I go back a number of years, and Jason has helped me create a really very simple pathway for anyone in the pharmacy space to get involved with PGX testing. So first and foremost, Jason, can you tell our listeners how you got involved with RXVIP?
In talking about my background, I started in college and got a bachelor's degree in biology. After my graduation, I went on to work at the Mayo Clinic doing spaceflight research with the Mayo Clinic and NASA Ames Research Center. And from there, I went on to a master's degree at the University of Connecticut in physiology and neurobiology. And in thinking about where my career was going to go, I went to pharmacy school at the Long Island University College of Pharmacy, where I graduated at part of top of my class, and then started to work as a hospice pharmacist. And in dealing with patients there, I did pain management and hospice pharmacy in the retail setting, and eventually went on to want to take on greater challenges and started to run pharmacies out on the East End of Long Island for about 10 years. And in dealing with the retail environment for as long as I did, I wanted to, again, expand what I did and how I did it and help more patients. And that's how I hooked up with Kenny.
So, Jason, with that breadth of experience, your perspective of RXVIP, can you share it with our listeners? Because, again, with all of the things that you've done, RXVIP apparently brought even more patient-centric care to your vision. So could you share that information with you, what you felt?
Yes, absolutely. It was more important for me at the time to enhance my role as a pharmacist and enhance the role of a pharmacist by delivering a more professional and meaningful consultation to patients. And that's what RXVIP did for me initially.
So when we spoke initially, our focus was we weren't going to be dispensing prescriptions. We were going to be dispensing, as you say, that care, compassion, and empathy instead of those prescriptions to enhance the role. So as we did that, the first thing that you did, and you really were very forward-thinking, is you shadowed me. You came to my facility, and you basically said, I want to see what it is to be a concierge pharmacist. So can you tell me a little bit about what that experience was about?
Well, I was working full-time at retail, and what I did for myself was to take one day off of retail and use that day to re-energize myself as a pharmacist. And what I got out of RXVIP in the beginning was to become a better pharmacist, not only in the space that we worked within in the doctor's office, but as a retail pharmacist as well. And so my one day off of retail, I would shadow Kenny at the doctor's office and learn exactly what it was that we did, or Kenny did. And so what it really was is another extension of experiential learning. And I think that most pharmacists could afford to take one day off of retail or just their day off and come in and enhance their career and make themselves a better pharmacist.
Well, that's great. And really, I think in every instance, if a pharmacist wants to do something outside the box, they can. It's just a matter of, as you say, taking the time and making the time. And if you can be in front of the patient more often than you are in the traditional retail environment, it gives you an opportunity to do what I love to do, which is consultation. Because consultation for me is more than, do you have any questions for the pharmacist? I believe it's the opportunity that a pharmacist has to show the patient, to care for the patient, and to listen to the patient so that they can keep them on a path to better health. For me, that consultation only really got fulfilled when I was in the physician office. So I appreciate the fact that other pharmacists have taken this pathway because it's a very simple pathway to follow. Jason, from a clinical standpoint, when we got involved with pharmacogenetic testing, which is the topic of our show, what was it about the PGX pharmacogenetic testing that appealed to you?
The results that we get from the pharmacogenetic test are extremely important, but besides how the results come, adherence and adverse drug events are one of the leading causes of death for patients in the United States. This pharmacogenetic test allows us to reduce adverse patient outcomes and that cause serious death or injury, and actually increase the cost of health care. So this PGX test for me has allowed me to increase patient adherence and decrease ADRs.
You know, it's funny that the clinical perspective, and when I talk to students or other pharmacists and they say, gee, I'd like to do something clinical, this really feeds right off that, but it really becomes very simple as the pharmacist who is the expert on medication to look at that test result, which is very comprehensive, and simplify it, distill it down so that a care provider, a physician, can make an actionable choice of medication to keep that patient on a path to better wellness. For us, RXVIP is simply raising awareness that pharmacogenetic testing does exist. The fact that we can bring it to every pharmacist and have everyone in the industry be involved is the exciting part of our initiative here with RXVIP. I believe, and Jason, with your actions, you've also proven that now is the time to do this. Do you agree?
Absolutely, Ken. Now is the time for everybody to get involved, not just pharmacists, but the pharmacist, the doctor, and patients. We're really here to raise awareness. 4 billion prescriptions written every year. To that, there are millions of people who are being impacted by medicine every day. This pharmacogenetic test will help us to raise awareness to the fact that there are adverse drug events, and caring pharmacists who know that they dispense these medications and could be harming people. We're here to say that there is a way to reduce these adverse events and to increase patient care and compliance.
Everybody throws numbers around like they're, a billion, a trillion, a gazillion. But if you talk about 125,000 people who died from an adverse drug reaction, if you're in a pharmacy filling 300 to 400 prescriptions a day, just imagine over the course of the year, those prescriptions ultimately count to 125,000. Imagine if every bag that you put a staple on and every prescription you verified killed somebody. Now, this is not to scare anybody. Drugs are good. Drugs provide good outcomes. But we need, as pharmacists, to be aware, and we need to care. And if we are caregivers and care providers, we will be recognized in our industry as such. So this is not something that can be done in a traditional retail environment with the fast pace and the workload and the other initiatives that have to be done for dispensing. However, every pharmacist can be involved in PGX testing. And we want to talk about, Jason, because you and I have worked on some initiatives that have actually been extremely successful in the environments where we bring awareness. Can you talk about a patient-centric initiative that we recently launched that has had amazing results?
Absolutely. We have a exciting and really patient-focused letter, very patient-centric letter that we use to raise awareness about pharmacogenetic testing that the patient can take directly to their physician. So how do we get this letter in the hands of patients? Importantly, what we do is work with pharmacies. Specifically, we're working with a very special compounding pharmacy here on Long Island, and they provide this patient-centric letter to every prescription that goes out of their pharmacy. They use it as a bag stuffer and allow this information for every prescription that they fill to get into the hands of their patients. We also work with other models, including independent pharmacy, and Ken can speak to our relationship with a wonderful organization called Caregiver Support Network.
Well, actually, being in the pharmacy profession, we're committed to continuing the life and health of the independent pharmacist. We can't have on the corner of every street in America just chain stores. It just is not right. The independent pharmacy owners and their staffs are committed to the communities that they work in and live in, and we believe that we need them to continue to be the go-to entity that patients looking for personalized care can go to. So towards that end, this letter allows them to further engage with their patients, to further engage with the physicians in their neighborhood who respect them. You're not just calling for a prior authorization. You're reaching out to them to say, doctor, we're doing something that can help you prescribe the right drug and help you avoid adverse drug reactions. So engaging with the physician is the core of what RXVIP is hoping to do and accomplishing, because bringing that pharmacist and physician together is a better solution for healthcare. So Jason mentioned the specialty pharmacy that we work here on Long Island, and they're a thought leader, a company called Town Total, and kudos to them, and a call out to Joe Navarro and his team for embracing this initiative. They have 3 of their pharmacists, in addition to Joe, who are initiating this program with us, where they're reaching out to their patients and providing this patient-centric letter. Last week, I had a very interesting dialogue and day with an individual named Howie Jacobson. Howie and I went to school 40 years ago, and we had been out of touch until. So in talking to Howie, and really, has 3 wonderful stores here on Long Island, and they're stores that are always looking for out-of-the-box initiatives to grow their business. So I spent the day with Howie, and we walked around together, and we spoke to physicians in his office, and we opened the dialogue about how Howie is utilizing this letter and how he is going to be connecting with those physicians and his patients to do more patient-centric care. Finally, Jason mentioned a company called Caregiver Support Services. Pharmacists are caregivers, whether it's thrust on you personally or in business when patients come in and need help. So we partnered with a nationwide organization called Caregiver Support Services. They're in Omaha, Nebraska. And just like these Sunday conversations are helping pharmacists, we'll be doing webinars and open dialogues and conversations every Sunday so that caregivers who are taking care of their loved ones will know that this letter can be taken to their doctor and we can save their life. So Jason, when we talk about this professionally, it has all of the ingredients for success. But can you make money by being a pharmacist who promotes PGX?
Kenny, you can make money doing this.
Okay.
This is a very exciting area. Not only can I enhance my profession and my career, but I can also make money doing it. So I started, like we had talked about earlier, taking 1 day off of retail. That evolved into me taking every day off of retail and then became full-time with RXVIP Enterprises in December of last year.
So you wouldn't have done that if you didn't see a pathway to financial reward.
If there wasn't a clear pathway that we could give to everybody, I would not have left the security of a job that I already had.
Yeah, but I think it's important. We don't want to mislead anyone. This is a process. It's a process of engaging with a physician in your neighborhood or multiple physicians. Imagining opening up multiple stores. Imagine you could be a chain of practices, and those practices are yours. Those practices not only would be you'd be compensated for the pharmacogenetic testing initiatives, but there are other value-based services that once you're in the door, once you have that relationship, we focus on chronic care management, which is a Medicare program that Medicare puts $17 billion with a B, $billion into. We focus on wellness prescription checkups as patients who visit their doctors. So there are are many other products and services that RXVIP can offer the physician and their patients by doing it with a concierge, pharmacist, PharmD, or even student of pharmacy. I am committed to the students because I just think the profession has been them enough to just give them an option to go into fast food pharmacy. So we are going out to bring every pharmacy student the awareness that they too can be involved in pharmacogenetic testing. So, Jason, we did something a couple of weeks ago from a scholastic standpoint for our students. Can you touch on that? Because we created a very interesting appy.
Well, it's the very first of its kind fully remote appy that's been accepted by St. John's University and Buffalo. We now have the ability to take on many, many more students than in the regular one-on-one appy environment, and we can touch to so many more students all around the country. And this fully remote program will allow them to learn what we do, how we do it, and how it can impact their lives and the lives of this
pathway. Was one of my first appy students was a young PharmD candidate, Bethany Abrahams, who was at Creighton University. And Creighton has a remote PharmD program where they do independent study. They visit the campus once or twice a year. And I found it very interesting that education could be done in that kind of format. So we kind of followed that. Bethany helped us initially, map out what would be a good rotation. We then got University of Buffalo students, who we are on appy now, to create something that resonated with them. And we're kind of calling it a MAPI because it's more advanced a professional practice experience. It's a totally independent study, totally remote. And as Jason said, we can take on any student. So if you're a pharmacist who knows and works with an intern, a student of pharmacist who you believe is on the right path to our profession, send them our way and we'll do something that will enhance their career as well. Because we believe that they should be able to be providers when their career starts.
And not only do we use this remote education process for our students, but I know that there are pharmacists out there who might be a little afraid, let's just say, to take on a new initiative that's different. It's out of the box. It's not exactly what they went to school for. Or for some people, maybe it is what you wanted to go to school for, but don't know how to implement this. We fully train through this MAPI students of pharmacy, pharmacists, PharmDs, and also our non-pharmacy friends in how to do this and impact the lives in their own communities.
Every one of us has worked in a retail store where you looked at that technician or that intern and you said, boy, they're special. They really are helping us run the store. I mean, we know we can't run a store without the quality of the technicians and the interns and the people who really are doing the work that we then end up verifying. When I saw a press release this week about a major retail chain raising their minimum wage to they're still $4 away from McDonald's, fast order people who work there to get burgers instead of prescriptions. So if I had a prescription that was going to save my life, I would want it to be delivered to me by someone who probably is making a little bit more from the company who is employing her. Because they're saving lives. And those technicians, we want those people as well. We want those individuals. So again, if it's a student, if it's a technician, if it's a pharmacist who who would be interested in this, send them our way. If you have contacts at your university, send them our way. We are a team. We are a profession that needs to raise awareness that pharmacists can enhance the practice of healthcare and lower cost. So I want to thank Jason Cavolina for joining me this morning. He inspires me to raise the bar even higher at RXVIP. Since he joined the company, we've grown from 3 people to 30, so a 10-fold growth. And in the next week or 10 days, we'll probably double that amount because we're going to some career fairs and things like that. This is something who wouldn't want to do this? Who wouldn't want to save lives? Who wouldn't want to make extra money? Who wouldn't want to find an alternative opportunity than the work environments that we all work in? So if you're driving along or if you're listening to this at any time, this is PGX for Pharmacists. My name is Ken Sternfled. I want to thank our listeners. Please follow us on the Twitter handle, PGX4RX. Make sure you subscribe to the Pharmacy Podcast Network because it's an extraordinary platform for forward-thinking, out-of-the-box pharmacists, which I know all of our listeners are. So I want to thank you and wish you a wonderful day.